So by this point in time, if you haven't already had an employee who may have been exposed to COVID-19, there's a good chance that you will in the near future. So the CDC has issued guidance on what employers do if one of their employees has been in close contact with a confirmed case of the virus. Say the person is taking care of someone at home who is diagnosed with the virus, or someone, an employee who may have been in contact with someone who has symptoms and may be believed to have the virus but has not been tested or confirmed. So the employee may remain in the workforce so long as the employee has no symptoms and the employer puts in place 5 basic precautions. And the first one is pre-screening, and you're going to have to take the affected employee's temperature and assess the symptoms before they start working. It's ideally to take the temperature prior to the employee entering into the workplace. And though not stated specifically in the the CDC guidelines, I would recommend that you keep in place that temperature taking for 14 days. The next thing is regular monitoring. So if the employee doesn't have symptoms, the temperature is good, the employee needs to be advised that they need to self-monitor their own symptoms. If at any time they experience symptoms in the workplace, there needs to be someone who's designated so that this employee can report those symptoms. And as part of this regular monitoring, you can also symptom check your employees, and you can do that on a daily basis when you're taking the temperature. I would also recommend that keep written notes of these symptom checks and the temperatures. They're confidential, not to be disclosed, maintained strictly in a place separate from the personnel file, and only personnel with a need to know should have access to that information, since it is private medical information of the employee. The next precaution that you need to take is that the employees need to wear a mask for at least 14 days. And this requirement just shows how outdated or how frequently all of these guidances on a variety of issues are changing, because now with the local ordinances, masks are required more than 14 days and for all employees, not just those who may have been exposed to a confirmed or suspected case. The next measure is implementing social distancing. And again, this is already pretty much required statewide. It's going to be a challenge for some operators to maintain that 6 feet between employees. But it's not rigid, it's flexible. You maintain the social distancing as best as your operations can permit. And I would suggest thinking out of the box and different creative ways to come up with maintaining that social distance as much as possible. And of course, the last precaution, again, is something that is required throughout the state and all the local counties, is to regularly disinfect and clean all the spaces, shared common areas, the restrooms, any shared equipment.